How are you?
We are fine, thank you, teacher Kakastin.
Good. Money. Tebaya gives the money.
At school level, I really miss the teaching that I used to do from grade 1 to grade 8, and especially in grade 8 where I used to handle Kiswahili. Mimi nilikuwa mwenyekiti wa chombo la Kiswahili katika gatuzi la Kisii, na hata sub-county mimi ndimi nilikuwa mwenyekiti wa chombo la Kiswahili. So I really miss the consultation that teachers used to make to me. I miss the classroom teaching, the actual classroom teaching, kuwatayarisha wanafunzi kwa mtihani wa kitaifa KCPE. But I still hope that one day I'll get a doctor who will treat me and I come back to my former self.
Well, there are those days when you wake up and you feel like, I don't have the strength to fight. I don't know. But then again, you ask yourself, then I give up, what next? What next? So you have that, the inner driving force. And when you look at people who have succeeded, because sometimes I read stories about people who have done 3 or even 4 transplants and all that. So I get to know this is not something that is happening to me alone. It's something that has happened to other people. And if they have made it, I can also make it.
After losing the hearing of the left ear, I was booked for surgery, which was supposed to be in December, cochlear implants. But I could not make it because the cost was US dollars 17,800. I could not be able to raise it to go for the cochlear implant surgery.
I still have my 4 kidneys with me. Yes, I'm rich. I have 4, which are not working, unfortunately. So I'll say it's cheaper here. It's cheaper because, like, in Kenya it's about 500. In India it's above 1 million. So here it's a bit cheaper. That is in the government hospital. But when you go to the private hospital, it's the same cost with India. Yes. And also now, another thing, when it comes to medication here, it's very, very expensive. The immunosuppressants, the post-medication they took after the surgery, unlike in India. Because here, in India, the cost is like almost 60% cheaper than here. That's why you see most of the people, sometimes they opt to go to India because this is something you'll take for lifetime. So in the long run, you get to save more than here.
In your opinion, why is it that we see very many Kenyans going to India? And from the medical board, out of 112 people who've gone to India in the last year, who've gone out of the country in the last year, 109 have gone to India, showing that a bigger percentage is going to India. Why is this the case that many people are actually seeking healthcare from other countries, India being like the preferred option?
There are 3 reasons why patients will go to India. Number 1 is simply because the Indian health system is better. They have taken time as a country and as a people to develop the health system. They have put in the latest technology and they have ensured that the waiting times are reduced. They have they've taken up as many doctors as the system can offer and other healthcare workers. And to a large extent, their system works for them. It's not perfect, but it's certainly better than ours. And so there are treatment options they're able to offer that we can't offer because we've simply not invested in those areas. If you look at this country, for example, in the diagnosis of cancer, a PET CT scan is really important. It's something we don't have. They have latest technology. They have better doctor-to-patient ratios. They have well-built systems, and they have, just general better quality of care. Another component relating to the better system is just how they treat their patients in the public sector. You wouldn't notice a difference between a public hospital and a private hospital in India in terms of just the interaction between the healthcare personnel and the patients. That is not the case here in Kenya. You'll have very good treatment in a private facility, and in public facilities not so. So that's the first reason. The second reason is a general perception that India works. Now this can be dangerous at times because that perception is not uniform across all diseases. There are some diseases for which going to India makes sense. The others where going to India is an unnecessary cost, is an unnecessary travel expense, and doesn't offer any benefit. Now the third reason is historical mistrust between the public and the Kenyan doctors and the Kenyan health system. And I think this is one area that the doctors themselves can put in a bit of effort to, restore that confidence, to the Kenyan population that the Kenyan doctors are good enough and the Kenyan doctors work. Because that's the truth. The Kenyan doctors can achieve the outcomes that are similar to other areas if facilitated in the system. Now, this mistrust, I think, is born out of situations where our own doctors could have been a bit lax in communicating to the relatives, or not, or even to the patient, and not being forthcoming with information. That can be a problem. But then also related to this is a situation where, as a people, as a country, unfortunately, we believe that foreign made is better than Kenyan made. And that has been disastrous. I saw an article today talking about back then when we were trying to build our own motor vehicles, and the Kenyan people, laughed at our own Nyayo Pioneer cars. India did its Tata, and now we are looking at a few about 30 years later, and Tata is at the same level as any other manufacturer, and our Nyayo Pioneer is a relic at somewhere else. The same thing can happen with healthcare. If we support our own system and build it, then in a few years we'll be at the very top of healthcare provision. The third is very aggressive marketing that sometimes is coupled to dishonest means to draw patients out of the country into India for conditions that can be treated here in Kenya. And that became such a huge problem that the board had to take some action against individual doctors and also just as a country. Look, the Indian healthcare system, the medical tourism in India is an $8 billion industry with projections of up to $32 billion. That is $32 billion. That is almost the entire budget of this country. That's what they make from medical tourism in 1 year alone. And so what they did is the number of salespeople who came into the market and got into agreements with individuals here in this country to more or less take patients out to India and get monies in return as commissions and so on. And what this did is that a lot of people went to India for things they ought not to have gone to India for because they could be treated here and in some instances more affordably. Now, the problem with this is you'd go to India, number one, for something that cannot be cured. You're going to India with cancer that has spread, and there is no non-medical solution to that problem. And so you're basically going to spend your money, and when you come back, you're not going to get any relief. The second issue is unique bugs. I saw at least one instance where a patient traveled from Kenya to a new environment and acquired new drug-resistant strains that they're not used to, and within about 2 weeks, the patient had succumbed in India. So it's important for people to know that the Indian system, yes, could be better than ours in some areas, not all, and even in those areas, they're still not able to do miracles.
The feeling for many is that the Kenyan doctors do not tell the truth or do not give the patient all the information. Mm-hmm. So when they say this cannot be done here or there is nothing else that we can do for you, then people tend not to believe that. Is it just a general view or perception of the population with the doctors, or what is it that then people cannot trust what the doctors here say?
Well, there's a big misconception, actually twofold, that one, the Kenyan doctor is not competent. I think that is the biggest misconception, and what it drives is a sense of a lack of confidence, basically. So that you meet a specialist in Kenya giving you information, you'll not trust it until you get the same information from a different center. And I think that is key in the number of referrals we see following advice from local doctors. And I must say that most doctors in Kenya do know what they're talking about, and they're usually right. There are exceptional cases where there may be a variation in the diagnosis, mainly because of the equipment used. But then in most cases, our doctors are actually spot on. The second issue that drives this is many years, could I say, historical mistrust between the patient and the doctor. And I think this was born out of a situation where the doctors in the public sector would not routinely indulge the patient freely and tell them everything that's ailing them. That difficulty, that challenge due to communication was a big driver of mistrust over time. And it has taken time for the population to get over that.
After going to India and coming back, how is the post-operative or how is the follow-up after getting treatment from India here in Kenya when people having come back? Because follow-up of any treatment of any surgery, any disease is very key towards, healing. How is this done normally?
Well, that's one of the biggest challenges of getting treatment abroad, because it's important that the team that sees you continues your care long term, unless they have a linkage with the local doctor who can then continue follow-up. In fact, many patients end up realizing that after they've undergone treatment, follow-up becomes a problem because nobody else can follow them through, whom they have faith in and whom they believe is giving them the best care. I know there have been some attempts to develop linkages between local health professionals and the Indian counterparts, but these haven't worked out very well. And by far the preference is, if you have the service available here in Kenya, that you have it right here in Kenya, because follow-up is then consistent and you can have any changes, any complications monitored and addressed appropriately. If you look at Indians themselves, they have numerous complaints about the health system. Every so often you hear massive complaints about facilities, areas where they felt the doctors didn't do so well, areas where they feel they have inadequacies, and these are real issues. And there are certain conditions people just ought to know cannot be treated. The time when we want to send you to India is when we know there is something you can get in the Indian system that you can't get here, or that system offers you a cost advantage. In the absence of those two factors, then it makes no sense to go to India. If you have met doctors here and they've said there's no medical treatment that's outside of this, that should suffice. There was this initial euphoria where people thought that there was a miracle cure in India, that if you're sick, you go to India, you'll definitely get better. Now, with time, people have come to realize that that's not the case, that in fact, the Indian system is using conventional medicine, and like any other health system, you'll have good outcomes and bad outcomes. And our experience as a country is that in fact, if you go to India for a treatment option that's not available in Kenya, then it makes sense. Many people who go to India for diseases they have been told may not be treatable here or even in India, many of them end up getting disappointed because they will find that the information given was actually similar. But there's also been a bit of a disservice to the Kenyan people by a group called middlemen and salespeople. The Indian medical tourism sector has made between 8 billion to a projected 32 billion per year, $billion per year. That is, $32 billion will be in excess of the Kenyan budget, and that is tremendous amounts of money. And so where there is such a financial incentive, you'll find middlemen who are given commissions, both from India and in Kenya, who would send people who don't necessarily need to go to India, who have ailments that can be treated right here in Kenya, into India for care. And, that means that you will go to India for something that you don't need to go to India for, and when you come back, you find you didn't get any help, you spent the money you had, and the outcome still is adverse.
So looking at the cost implications, many that have gone to India or gone to any other country have said even when they put in the flight cost, the accommodation cost, and the treatment cost, it's way cheaper than what they are spending or what they would have spent here in Kenya. Is this the case?
In some areas, India is cheaper. I think the one area that India is indisputably cheaper is the cost of medication. There's something called patent rights for medication, and India for the longest time did not offer patent protection to big companies. What it meant is that a drug would be produced today in the Western world, and somebody can create the same drug in India the following day at a price that's about 5% the cost of the innovator drug. Kenya, on the other hand, doesn't have such protectionism, and so the cost of drugs can be extremely high. The other issue that makes the Kenyan system suffer is we don't manufacture most of the items that we use locally. We import almost everything. India, on the other hand, has indigenized most of their production, most of the items they need in the health system. They actually make them, manufacture them in India. Thirdly, we have a very unfriendly tax regime that taxes healthcare commodities massively. You could have as much as 50% or 46% taxes on certain products in healthcare. For you to bring a CT scan here in the country, you'll probably pay about 46% in taxes and other levies. There'll be a VAT, Pharmacy and Poisons Board, Railway Development Levy, and so many charges. By the time you're done, the price is almost 1.5 times what it should be. Now, all these things cumulatively make healthcare expensive. There's also a concern that certain charges that are levied could be a little bit higher than as compared to what the Indian system has. Cumulatively, it then means that a person seeking healthcare in Kenya could end up paying a lot more. But as I've said, this is not the case for everything. There are some diseases that would be easier to treat in Kenya as opposed to incurring the expense of going abroad.
Are we improving as a country? From your own experience, having been in the health system for quite some time, have you seen any improvement? Are we making any strides towards improving our healthcare system, especially the public healthcare, where a majority of Kenyans seek healthcare services from?
You'd say that there are certain areas where we have improved, but then there are some areas where we have not improved. The biggest improvement, I must say, is in NHIF. About 4 years ago, NHIF was spending as much as 45% of its collections on administration. The healthcare benefits from NHIF did not make sense, but now NHIF is paying for surgeries, it's paying for dialysis, it's paying for cancer therapy, it's paying for a lot more in a way that makes sense for anyone to have NHIF now. The second area that we have improved on is retention of healthcare workers, and in particular doctors. About 2011, we were paying doctors a take-home of about 40,000 shillings. And so our doctors were leaving medicine to become pilots, to go to Rwanda, to go to Botswana, to go to South Africa and Europe. But then over the last 4 or so years, we have seen some transformation, and now we have had better retention. In 2011, 80% of Kenyan doctors would leave government by the third year. Now we are having better retention to the extent that we have had a tripling of the number of doctors available to government from 2,300 to about 6,000 doctors. And in fact, now the government is unable to employ all the doctors coming into the space. And I must say that the inability to employ really speaks badly of our own planning as a country, because until we hit a number of about 19,000 doctors, though our need is 40-something thousand, until we hit a number of about 19,000 doctors, we can't say that we're able to offer the basic minimum in terms of healthcare. And so this country should be celebrating when we have many doctors graduating, instead of saying we don't have a budgetary provision, we cannot take them in, because the cost of not taking them in is much, much higher than it would be to pay a few doctors to be in the public sector, serve the people, grow their healthcare, improve the productivity, and generally grow the economy of this country. Devolution has worked in some counties, and in some counties it has not worked because, well, I'll give examples where you'll see counties that have revived facilities that have been defunct for decades. You'll see new ICUs cropping up in several counties. I'll talk about Mombasa, for example, Kisii, Level 5, Machakos to some extent. You have some of these facilities, some of these county governments investing in healthcare. Then there are some counties where it has become much worse. And what happens now is that even the little money that was available in the hospitals is now being taken to the central county funds, and it's making it difficult for the money to get back into the health facility. And in many counties as well, healthcare is probably a little bit worse than it was many years ago. Of course, there are other factors that complicate the issue of devolution, including tribalism, but I think with time this can be overcome. So yes, I would say that overall devolution has had its merits, and especially because certain counties have done a good job, they've tried, but there's still a long way to go. I think addressing healthcare is not a county-by-county issue. It should be looked at as all 48 governments, including national government, working together to make healthcare better. There's one area all counties have struggled in, and that is human resources for health. And I think the union has been consistent that management of human resources for health should be collaborative as opposed to every man for himself.
What can we do to reduce or even stop the number of Kenyans going to seek treatment in India or any other foreign country? Is there anything that we can do as a country to remarkably reduce these numbers?
I will set that answer twofold. To reduce the number of patients going to India, number one, we have to strengthen our own health system, and it starts with leadership and governance to have a vision to make the health system better. You look at human resources for health, provide medication, reduce the cost by removing some of these taxes that you put on healthcare products. It makes no sense to tax healthcare products. It just makes them expensive because they're being passed on to the patient. So if we improve that system, that will be one step towards making healthcare in Kenya better and reducing the number of Kenyans going out to seek medical attention. But then on the other hand, then the Kenyans themselves have to know and believe that Kenya is capable of doing a fantastic job in every area, not just healthcare, but in every sector of the economy. There has been this long-standing perception that Kenyan is not good or that Western is better. That if it is made out of Kenya, it's good. If it's made in Kenya, it's bad. And that's not the case at all. We see a number of Kenyan doctors going to the Western systems, into the UK, into the US, into Germany, and they're the best doctors in those areas. And so the issue is not the people. It is the system. And as we build the system, let us have confidence that our own system can work. That is the only way that we're able to move forward and reduce the number of referrals. I must say that Kenya has a unique opportunity. If you compare Kenya to other countries around us, we probably have a better health system, meaning that the very same thing India has done in attracting people from other countries to come in and utilize their healthcare and bring in billions of dollars annually, we can do the very same thing here in Kenya. If we were to, for example, and I'm just saying this, I know there are facilities that are planning to do it. If you were to bring a PET CT scan here, then it means you no longer have to go to South Africa or to India for this kind of a service. You can come to Kenya. If we avail doctors, if we avail medication that's affordable, if we avail a healthcare system that works, then all our neighbors would have Kenya as a referral point to go to. It's probably cheaper than South Africa by far. And, if we bring down our costs, then certainly cheaper than India if we deliberate and concerted in this effort. There are two ways of getting healthcare in this country, either in the public system or in the private system. Now, make no mistake, healthcare in itself is very, very expensive. The costs you see in the private hospitals is the approximate cost of actual healthcare. The reason why it may be cheaper in public facilities is, number one, subsidies from the government in terms of the human resource costs being taken care of, and then economies of scale, where the public hospitals could get drugs at subsidized costs from companies like KEMSA, like Meds, and so on. However, even that is not adequate. Now, many Kenyans don't have access to healthcare insurance that will take care of catastrophic, healthcare needs that would arise. And so the truth is, if you don't have a lot of money, then you are better off not falling sick, because some of those costs have, in fact, bankrupted many families. The solution to this is the direction Kenya is seeking to go towards, which is to have universal healthcare coverage. Now, this is not rolling out as quickly as it could. There are some steps that we have taken. We have made strides, but we still have quite some way to go. I would suggest that the best way to achieve meaningful healthcare in a sustainable way is to develop our public sector to ensure that it can give healthcare at the level that the private hospitals are doing currently. And this is not impossible, because when you go to any private facility in Kenya today, they're not using foreign doctors, they're not using equipment that they're hiring from abroad, they're not located somewhere unique. It's just right here in Kenya, using Kenyan healthcare workers in Kenyan environments. And the same can be replicated in public facilities. What it requires is a vision to go ahead and make the necessary investments in healthcare and then work on that. If you see India working, it's because the Indian people and the Indian government worked on it. If you see Cuba working, it's because the Cuban people and the Cuban government prioritize healthcare to make it work. That's precisely what we need to do in Kenya today to make our system work. What we need is to ensure that we set aside money, train healthcare personnel, put in the equipment, build the hospitals, get high quality drugs, and then protect our society from high expenses through national health insurance schemes such as the NHIF scheme, but in a way that works.
The Kenyan agenda for universal healthcare coverage, in line with the World Health Organization's goals, is seen by many as the potential cure for this Indian phenomenon. If the prescription is crafted well and the instructions followed to the letter, Kenyans are likely to be cured of this chronic headache born of the fear of falling sick and wallowing in a vicious cycle of misery and poverty. That's it for Health Digest. I'm Dr. Mercy Korir.